Good afternoon and welcome back to Downing Street for today's coronavirus briefing. And I'm joined by Professor Jonathan Van Tam, the Deputy Chief Medical Officer, and Dr. Susan Hopkins, the Medical Director of Public Health England and NHS Test and Trace. And before I share some news on our vaccination programme, I'd just like to update you on the latest coronavirus data. If we could have the first slide, please. The data show that we are moving in the right direction. I think that's the third slide. If I could have the first slide, that would be great, which has the Office for National Statistics data on it. We'll try to get the slide up, but in the meantime, what the slide shows is that the number of cases is now down to 1 in every 145 people, and that the rate of decline is continuing, but actually the pace of it is slowing. The rate of hospital admissions shows a fall of 40% over the past fortnight, but there are still 15,485 people in hospital, and that's far too high. The number of deaths have more than halved in the last fortnight, but 380 deaths were reported each day on average over the last week, and that is far too high. The good news is that the link from cases to hospitalisations and deaths, which has had a grim inevitability throughout 2020, that link is now breaking thanks to the vaccination programme. And we've now been able to get the slide up. And this demonstrates, as you can see, that there's been a fall in the number of cases, another fall, but that the speed of that fall is slowing slightly. And this fact, and the fact that the pressure on the NHS has lifted somewhat, means that the UK Chief Medical Officers have agreed that the UK alert level has been moved down from level 5 to level 4, which is, of course, great news. But level 4 still means that there is significant pressure on the NHS. The number of cases is now falling by only 15% a week. In some areas of the country, that has flattened entirely, and 1 in 5 local authority areas has seen a rise in cases in the last week. I'm going to ask Professor Van Tam to set out more details of this and the geography in a moment, but I just want to say this about the figures. This stark picture shows that this isn't over yet. The stay-at-home rules are still in place for a reason. Every action that you take, every time you put your mask on, every time you stay at home, you are playing your part. This is on all of us to keep this under control. This is still a deadly virus. We will get through this, but we have to stick at it. We must all remain vigilant. And that brings me to the vaccination programme, because while the vaccination programme is rolling out at the pace of one of the fastest in the world, we're not there yet. We can all take comfort that through science we have found a solution. We've got a route out, and we will gradually be able to replace the protection that is there in the restrictions with protection that comes from the vaccine, and that is very good news. I'm delighted to be able to tell you that as of this morning, 19 million people in this country have had the vaccine. That's 35% of all adults across the UK. That also includes over 500,000 doses that were given yesterday. And it's easy for us to get used to these very large numbers. But that is 19 million people who are now starting to get the protection that we know comes from this jab. And we know that the jabs are saving lives right now across this country. And of course, the programme is expanding all the time. This week, we're bringing 10 more major vaccination centres on stream, including Towngate Theatre in Basildon and Reading Football Club. And I thank everybody who's continuing this expansion of the vaccination rollout. And these join our network across the country in cinemas and cathedrals, in mosques and museums, and so many other places that have been converted from whatever they do normally into these life-saving centres right in the heart of our communities. And we've seen this incredible enthusiasm about coming forwards too. As my colleague Derek Grieve, who heads up Scotland's rollout, told Her Majesty the Queen, he'd like to bottle the community spirit that we've seen. And I think we all feel that, and we can see it in the vaccination programme. And I'm very pleased to be able to tell you that today's data from the Office for National Statistics show 94% of adults saying they've either received the jab or they intend to do so. That is staggering. It's really, really good news that there is so much enthusiasm for this jab, and it's testament to colleagues who've worked so hard to build the confidence in the jab and make it as accessible as possible to people, which is what we're constantly striving to do. I'd like to give a shout out to Fazana Hussain, who is a GP in East London, who's been personally calling each of her priority patients, giving information about the vaccine and urging them to come forward and get jabbed. I also want to thank the whole team in Coventry and Warwickshire, who have delivered the highest uptake in the whole country, giving first doses to over 95% of the over 65s in their area. Thank you. It's an absolutely spectacular effort. This work is so important, and it's important because the fight back against this disease rests with every single one of us. And the more people who are protected, the safer we'll all be. So if you get the call, please come forward to protect yourself and to protect those around you. Now, throughout our vaccination programme, we've focused on protecting those at greatest clinical need, and this is the final thing I want to turn to. We offered a vaccine, for instance, to everybody in the top 4 priority groups by the 15th of February, and our current target is to get a first dose offered to everybody in the top 9 priority groups by the 15th of April. That's everybody who's over 50 or part of an at-risk group. Earlier this month, I asked the clinicians at the JCVI to set out what is the best order to offer vaccinations for the under 50s. I asked them to make this assessment based on how we can save the most lives and prevent the most hospitalizations. Earlier today, they published their interim recommendations. Next slide, please. The JCVI's clinical advice is that in order to save most lives, once we've offered the vaccine to priority groups 1 to 9, we should take an age-based approach and invite people to come forward in 3 further stages. First, people aged between 40 and 49 years old. They will be group 10. Then those 30 to 39, and then those who are 18 to 29, who will become group 12. This is the fastest and simplest way to roll out the jab. Our moral duty is to put saving lives first, and that's what we've done. So I can confirm that we will follow this clinical advice. We will get jabs into arms as quickly as we can in the clinically recommended order. And once we've met the target by the 15th of April, we'll move on to these priority groups 10, 11, and 12. I'm sure that we all agree that the best approach is the one that saves the most lives. So that's what we're going to do together. And while we make this great progress on vaccines with one of the fastest rollouts in the world, we've all, though, still got to hold our nerve and do our bit. It's on all of us still to stay at home, to protect the NHS and save lives. Thank you very much. I now want to hand over to Professor Van Tam to go through those data in more detail.
Thank you, Secretary of State. I'm afraid I'm going to show you a couple of quite sobering slides now, and I'll explain why as we go through. First slide, please. So this is a UK map of case rates, and you can see it's a heat distribution from the darkest blue at 250 cases per 100,000 population per week, through to the lightest colours where we're getting below 50 cases per 100,000 per week. And what you can see on this slide is that there are still quite a few areas of the UK that are burning quite hot. And you can see that concentration in the Midlands and extending from the east to the west coast in a broad diagonal belt. You can also see some further hotspots in Scotland and Northern Ireland. So this is the first slide I wanted to show you, that although it is generally good news, I'm afraid it is better news in some places than it is in others, and this is not a battle that we have won yet. Next slide, please. At least as importantly as the rates of disease are the rates of change of disease. And these are 7-day rates of change through the, across the UK again, showing colours from white through to dark purple, where the rate of cases has increased in the last 7 days, through to from white down to dark green, areas where the rate of change has decreased. And you can see quite clearly, if you look for the purple and the dark purple spots, I'm afraid there are quite a few of them. And that does show that in some parts of the UK, case rates are changing, albeit slowly, but in the wrong direction. This is not a good sign and reinforces the fact that I'm afraid this battle at the moment is not won. Thank you. Now, I'll just continue, if I may, Secretary of State, with a few further remarks that relate to the slides I've shown you. As you heard from Secretary of State, we have now completed 19 million first doses of vaccine. We've given those first doses very successfully to cohorts, priority cohorts 1 to 4, and we're moving at some speed through cohorts 5 to 6. But these are first doses. People do need a second dose. And given that the totality of the cohorts 1 to 9, the priority cohorts, is about 30 million people, each of whom need 2 doses of vaccine, by my rough calculations, there are something like 40 million doses still to be given. So much as it's encouraging, and much as I am really very upbeat about vaccines and how they are going to change how we live and what the disease is like between now and the summer, there is a long way to go. And my inbox in the last week has been besieged with people writing in saying, I've had the vaccine, essentially, can I now start to break the rules? Can I go and see my grandchildren? Can I do X, Y, and Z? And the answer to that is no. We are not yet collectively, as a country, in the right place. And all of the patients that I vaccinate, and they'll know it if they're listening on the TV, I say to them, and remember, all of the rules still apply to all of you and all of us until we're in a much safer place. It doesn't change because you've had your first dose of vaccine. And so, you know, please don't be tempted to think, oh, well, one home visit might be all right now, weather's getting better, going to be a nice weekend. One small gathering in your house won't really matter. I'm afraid it does, and the data on the slides speak for themselves. So my kind of key message tonight is, look, this is all going very well, but there are some worry signs that people are relaxing, taking their foot off the brake at exactly the wrong time. It's a bit like being 3-0 up in a game and thinking, well, we can't possibly lose this now. But how many times have you seen the other side take it 4-3? Do not wreck this now. It is too early to relax. Just continue to maintain discipline and hang on. Just a few more months. Do not wreck this now. We are so close. Thank you, Secretary of State.
Thank you, Professor Van Tam, for that clear, if sobering assessment. We're nearly there. Let's not blow it. The first question is from Emma from Worthing.
What plan do you have for supporting university students through your roadmap out of lockdown?
Thanks very much, Emma. It's an incredibly important question, and the roadmap sets out some of the details in terms of the return of universities to something more like a normal university experience. The answer to your question depends on the course that you're studying, and therefore how much you need to be physically present. There's some courses that have been running throughout, including with, of course, with COVID-secure arrangements, where people need to be in a lab or a medical school, for example. And then there's others, and especially art subjects, where it is easier to learn and to have that over Zoom or video conferencing. And so there is quite a lot of detail here, and the Department for Education have put out a significant amount of guidance. But of course, as with everything else on the roadmap, we've set out the indicative dates, but also we've got to be vigilant on the data according to the 4 tests that the Prime Minister set out. Final point, we have today set out the order in which we're going to vaccinate people, and people who are between 18 and 29 will come in group 12. So it is incredibly important for you to get your jab when it's your turn as well, because that will help not only to protect you, but to protect everybody around you as well. Thanks, Emma. Next question, Hannah from Belfast.
Why has the government removed guidance from last summer, allowing couples in established relationships not to socially distance from each other? And what would stop support bubbles being extended to allow couples to see each other again without limits on social contact?
Well, thanks, Hannah. We made the change that we did because as we went into the lockdown over the autumn in November and then again at the start of January, we wanted to make sure that we did everything we possibly could to stop this from spreading. And I'm absolutely sure that the actions that everybody has taken and the sacrifices that people have made have had that very, very positive impact. We do look, of course, at the support bubbles. We hold these all these rules under review, but the purpose of the support bubbles is so that people living on their own can socialise, because we know just how difficult it is to live on your own if you have no contact at all. So that's the reason for that support bubble. Thanks very much, Hannah. Next question is from Hugh Pym at the BBC.
Thank you very much, Secretary of State. The government says it's prioritising education in the weeks ahead. What do you say to teachers who argue that giving them priority for the vaccine could help reduce absences and disruption in classrooms?
Well, thanks, Hugh. The first thing I'd say is that we looked at all of these different considerations, and the JCVI looked at all these different questions, including, of course, the prioritisation according to different jobs that people have. But the overall view that we came to was that the right thing to do, the moral thing to do, is to make sure that we save the most lives. And the JCVI looked at the clinical evidence and also the evidence of how quickly, operationally, we can jab everybody. And that means that the clinical guidance from the JCVI is very clear that we should continue through the age range. And we also know from the data that, thankfully, teachers are no more likely to catch COVID than any other member of the population who goes to work. And so trying to come up with a scheme which prioritises one professional group over another would have been complicated to put in place, and wouldn't have done what we asked the JCVI to do, which I think is the right thing, which is to make sure that we minimise the amount of people who die by using the vaccine. I don't know whether JVT, you've got more details on this.
Thanks, Secretary of State. Hugh, I could just add a little bit more colour for you, I suppose, to say that the ONS data on the occupations with the highest rates of death begin with restaurant and catering establishment managers and proprietors, follow on to metalworking and machine operatives, food, drink and tobacco process operatives, chefs, taxi and cab drivers. I won't go on, but all of those death rates in the groups I mentioned are in excess of 100 deaths per 100,000 for males. If you look at teachers, and the ONS has now assembled some data on teachers for the period 9th of March last year to the 28th of December, the figures for male teachers, the figure is 18.4 per 100,000 for mortality, and that compares with an age average for a comparable age of 31.4. So if our objective is to save lives and reduce hospitalisations, then we have to start in a logical place. And if our objective is to prioritise by age, we would have to, by occupation, we would also have to start in a logical place. And you can see that is going to be very difficult because of the multiplicity of occupations that would need to be called forwards. And doing that is going to damage the pace of the vaccine rollout so much. And the big win actually is in speed. So the kind of message is really, when we're getting down into the phase 2 of the vaccine campaigns, it's more important to be in the queue, worry less about exactly where you are in the queue, but be reassured that the queue is moving really fast and that you're going to get to the front of the queue because it's moving fast. And that's really, I think, the analogy that I'd want to kind of paint for you, that being in the queue is more important than where you are in it, and then making that queue move really fast is the key. Thank you, Secretary.
Thanks very much, Hugh. Next question is from Liz Bates at Channel 4.
Yes, thank you. So as you just set out quite starkly, different areas have very different rates of infection, it seems. That would suggest that as we come out of national lockdown, we might see the return of local lockdowns. Is that going to happen? Or is that something that you want to avoid? And can I also ask JVT if we can have a bit more detail on what's behind those regional differences?
Thanks very much, Liz. So we propose to come out of the national lockdown altogether. These regional disparities are smaller than we saw in the autumn. We don't rule out taking local action in an individual area if we see a spike, and I'll ask Dr. Hopkins to say a bit more about that. But the goal is for us all to come out together. What I want to stress is that these data show how important it is that we still stick at it, that this isn't over yet. And the fact that, 1 in 5 local authority areas across the country is seen cases rise in the last week demonstrates that we all need to stick to those rules and to do everything we can to keep this pandemic under control. I'll ask Dr. Hopkins to comment on that and put more detail on, and then JVT to answer your second question.
Thank you. So I think we are looking into detail at the differences in the regions. Some of the differences that we can see relates to the occupations and workplaces that occur. And as you know, we have increased workplace testing with lateral flow devices. I think it's really important that people come forward for testing in the next 4 weeks, so that it gives us the opportunity to find those hidden cases in the communities and to allow the case rates to come down over the next 4-week period. We still have plenty of time in this time of national restrictions to reduce the case rates across the country. We'll also be working very closely with directors of public health and our regional health protection teams to ensure that we take local action right now. So we're not waiting for 4 weeks' time to see what happens then. And that's happening across the country right now with engaged teams looking at how we can find cases, contact trace in those areas and support people in isolation.
Thanks very much. And JVT.
Nothing to add, Secretary of State. Thank you.
Thank you, Liz. Thank you. Next question is Charlotte Ivers from Talk Radio.
Thank you, Mr. Hancock. We've had lots of calls from listeners this week who are raring to go to get their vaccines, but they're also a bit concerned and confused by the government's policy on vaccine passports. Are you able to give them a commitment today that they will never need to show a vaccine passport to get into the pub or to a football match?
Thanks very much. Well, look, this is an incredibly important subject. We know that there's some areas where certification is going to be needed. For instance, if a government of another country says that you need to show that you've had a COVID vaccine, obviously we then want to be able to help people, enable people to be able to show that certificate. But the wider questions have all been put into a review that, as you know, Michael Gove is leading. And I think it's best to allow that review to take evidence, to consider all of the broad range of issues, and then come to its conclusion. I'm sorry, I'm not going to be more specific than that. I don't want to fetter the discretion of the review, and I think it's right that we take our time to think about this. Thanks very much. And next question is Jonathan Riley from The Sun.
Good afternoon. To Professor Van Tam, there are reports today that school children as young as 5 are being told to wear masks in classrooms. Should teachers really be doing this? And is it really a necessity to stop the spread of COVID? And to Secretary of State, the COVID crisis has seen an outpouring of community spirit and volunteerism, including, of course, the Sun's Jabs Army campaign. Do you think these volunteers should be recognised in some way? And are you going to, or are there any plans to try and use this bank of volunteers after the pandemic to help our NHS?
Yes, two great questions. The Jabs Army marches on, and they're doing an amazing job in helping everybody to get the vaccines. And the voluntary effort around the vaccine rollout has been unbelievably brilliant. The number of people who've come forward, the enthusiasm that's shown, and I'm very grateful to everybody who's given up their time. We are looking at a system of NHS reserves. And the idea is that you have people who are committed to supporting the NHS through voluntary action, who have the training, for instance, and are on a specific reserves programme. And we're piloting that right now, but that's exactly the sort of thing that the Jabs Army might be called upon to do in the future in a broader sense, because we've just seen the unbelievable support that volunteers can give to the NHS when there's a big job to do. And I'll ask Dr. Hopkins to respond to your first question about masks amongst children.
Thank you. So I think the important thing to say is that we've looked and reviewed the data and the evidence on this. School children have the lower amount of infection, especially primary school children. And in looking at it, we've talked to educationalists, public health and clinical specialists. And the consensus view is very strongly to not advise school children at primary school age to wear face coverings. This is for two reasons. One is that they can have difficulties wearing them and keeping them on all day. And the second part of that is that it's really important that they can see facial expressions in order to develop their communications and language skills. Schools have delivered a lot of measures to reduce the risk in schools, and additional plans to test families of primary school children will also be in place as schools go back. And therefore, the strong recommendation is for primary school children not to wear masks.
Thanks very much. Anything to add, JVT?
My perspective on this is more parental than it is technical, and that is to say I just find it quite a daunting proposition to try and keep face masks on 35-year-olds in the same room. You know, I just think you should be concentrating on the teaching.
Thanks very much indeed. The next question is from Ned Simons at the Huffington Post.
Thank you, Health Secretary. Official figures show there are over 3.5 million NHS sick days in England due to mental ill health between March and October last year. But it's been reported that healthcare workers won't get a pay rise in the budget. What more are you going to do to support NHS staff other than asking the public to clap? And Dr. Hopkins and Professor Van Tam, if I may, last year's Eat Out to Help Out scheme was associated with an increase in transmission. Would you be comfortable with it returning this spring and summer?
So on the support for the NHS staff, this is an incredibly important question, and there's a huge amount of support being put in place to ensure that staff, especially those who've had a really tough time in this second wave of the pandemic, and who've had a tough time in many cases throughout the last year, to ensure that NHS staff get the R&R that they need. Of course, employment in the NHS is down to the individual trust, and there's a huge amount of work going on to make sure that people get the support to deal with traumatic experiences that they may have had. You know, I've supported in intensive care wards during the pandemic. I've seen the pressures that NHS staff are under. I know from talking to them what it feels like and the pressures that they've been under, both the constancy of the work, the enormous amount of work that's had to be done, but also the fact that when you are dealing with people and the death rate is so high, that has a significant psychological impact. So we are putting in place that support to make sure that people who've been on the front line in what can be traumatic situations get the support they need, the professional support they need, as well as the HR support they need in order to be able to have that R&R and be firing on all cylinders again, and have that resilience. And then when it comes to the second question, JVT.
Yes, thanks for the question. I mean, I'm going to give quite a clinical answer, really. When you put people together to eat and socialise over a meal, over a table, as we all like to do, and maybe a little drink is also consumed at the same time, and the volume goes up in the place, of course, it is likely that there will be some transmission. But really, who pays the bill or how much of the bill you have to pay for yourself is not a medical question, and one for politicians and in particular the Chancellor.
Thanks very much. Final question is from Jim Scott at the Northern Echo. Jim.
Thank you. Here in the North East, we have some GP surgeries having to cancel vaccine clinics because they are not receiving the supply that they expected. One surgery in our region can't run clinics until March the 5th at the earliest because of lack of supply. We have huge rural areas that rely on GP surgeries for vaccines rather than the mass vaccination centres used in urban areas. Why are people in the north still having to travel more than 40 miles in some case to get their dose? And is this a sign that your vaccination strategy has been designed for the south? And just one question to Professor Van Tam. North Yorkshire Police are still giving out hundreds of fines for lockdown breaches as people travel to beauty spots in our region, including in some cases more than 100 miles. Now that the Prime Minister has set out his roadmap out of lockdown, are you concerned people now think the end is here and are less likely to stick to the rules?
So, Jim, just on your first question, I'll ask Dr. Hopkins to come in. But one of the brilliant things about this vaccination programme is how it has been equal and fair UK-wide. And the North East has done a brilliant job in vaccinating. It came out of the blocks really fast and has done worked absolute wonders. And I want to thank, in particular, the volunteers and the NHS staff in the North East who have worked so hard to get these vaccinations done. And there has been a lower amount of supply across the whole UK in the last week or so. You'll have seen that in the last 48 hours that has picked up again. And yesterday we did over 500,000 jabs again for the first time in over a week. So that supply is coming back. We all know that it goes in, it's lumpy, it comes up and down, and we're going to have a bumper March. But I do know that there have been some vaccination centres that are so efficient, they've been able to use all of their supply, and I'm very, very grateful for the work that they've done. But the good news is that these challenges are faced equally throughout the whole of the UK, and I get people from brilliant local newspapers in the southwest asking the same question as you're asking about the northeast, and that gives me the impression that this challenge of the rollout is equally balanced. As far as I'm concerned, every single person getting their access to their jab in the northeast is as important as in every other part of the country, and we'll make sure that the programme delivers according to those principles. I don't know what more I can say about my enthusiasm for what the North East has done and really nailed it in this vaccination programme so far. Susan.
Yeah, I think that's exactly right. So the North East has been achieving over and above what the rest of the country has done. It's fantastic news. Everywhere is going to get vaccine, and everywhere will be able to deliver the vaccine to all of those from 1 to 9 over the coming weeks.
Thanks very much. And on your second question, JVT.
Yeah, thank you. Yes is the answer. I do worry that people think it's all over. The more they think that, when it's not, the greater the headwind they're going to give to the vaccine programme, and the more at risk will become the milestones set on the roadmap. And, you know, it's just a collective effort. It is actually up to us whether we can hold our nerve and see this through properly to the end of the roadmap, or whether we're going to kind of, you know, fall at the last furlough.
Thanks very much, and thank you all for joining the daily briefing today. Once again, I'm going to end with where I ended the opening, which is to say that this is on all of us. Of course, it's on us at the podium to do our duty and play our part, but it's on you as well. Every single person needs to keep sticking to those rules. Stay at home, protect the NHS, and save lives. We're making great strides, but we're not there yet. Thank you very much indeed.